the Functional Herbal Medicine Podcast. We are your hosts, Kristin and David. Today we're talking all about the cardiovascular system. It's a pretty big topic, so we'll touch on the major conditions associated with cardiovascular dysfunction, such as high blood pressure, atherosclerosis, high cholesterol. We'll also touch on how those can lead to more serious problems like heart attacks and strokes. But I also want to talk about it in the larger context of things, because the health of your cardiovascular system goes way beyond blood pressure or plaque formation, or even obviously heart-related things like palpitations. There's herbs to help with all those things, and we'll talk about that too. But I do want to highlight the importance of having a healthy cardiovascular system in just about any condition. I think our modern system kind of overly focuses on these end presentations of cardiovascular dysfunction, but it starts so much sooner in the microvasculature, which we will explain all about what that is. And then that in turn contributes to, again, so much more than just those few obviously cardiac related illnesses. I think the hard part is that cardiovascular disease is largely silent. So you don't often think about your cardiovascular system as something that you need to heal until there's already a problem. And then you have high blood pressure, or you have some level of atherosclerosis. And so really the best medicine is preventative here. And we receive nearly all of our nourishment and oxygen through the circulation in our blood. So our blood flow and our blood perfusion to the tissues is really essential for proper functioning and repair of all tissues. The good news here is that there's lots of evidence that herbs and plant foods can play a key role in maintaining cardiovascular and circulatory health. And actually, there's probably more evidence available that plants are more beneficial for this than there is even for drugs. So let's maybe start with like the clinical context that you've seen or that you've worked with cardiovascular system in. Like what types of things do you see come through the clinic, David?
Interesting enough, I kind of mentioned that as we're getting prepared for this, but a guy came in yesterday with cardiovascular health issues, and his approach is natural. I mean, we do see it on occasion, it's not a main thing that we see. We don't see people come in like all the time for high blood pressure or that are asking specifically for cardiovascular health. They're actually wanting more of these secondary things that you're going to probably touch on here in a minute. But interesting, like you mentioned, the nutrition herbal approach in comparison to pharmaceutical approach. I was chatting with this guy, and he's like, my doctor wants me to go on statins. I have twice as much cholesterol as they want to see. He's like, I don't want to do it. I'm not going to do it. And it brought back a study, and maybe this is something I have to like add to the links in below. But there was a study that showed that for every one person a statin drug helps, it actually causes two adverse effects on other people. So like there is the benefits for those people, but then there's two other people that are getting these serious complications, which, is like CoQ10 depletion, for example, mitochondrial depletion, that maybe we'll touch on later. But yeah, we see it. It's just interesting, yesterday somebody very specific came in as we're getting ready to record this podcast.
Mm-hmm. Yeah. Do you have a sense of like why that might be? Like, do you think that do people with medications kind of not think about going the other route, or do you have any thoughts there?
I wonder. I mean, like I said, we have a few clients that, most of the medications that I'm actually really cautious with are the clients with cardiovascular medications. Mm-hmm. And I'm wondering, maybe, this just popped in my head right now, I'm wondering maybe it's because when we finally see a cardiovascular patient, they've already gone to these later stages of like almost a stroke or almost a heart attack, mm-hmm. or they're doing their checkup and they're like, oh, your arteries are 70% plugged or whatever. It's kind of like they've already gone to the system and they've already started these really strong medications. And that's like, so once they finally come in, they're like, yeah, I want to do Herbals, but I'm on Eliquis and I'm on this statin. And so we kind of catch them later. Usually it's not the people that have high risk cardiovascular issues are usually just like high blood pressure. It's not usually somebody that's like early stages atherosclerosis. It's very interesting that we're catching them later. That's kind of my thoughts on it. What about you? I mean, do you have any thoughts on why we're not seeing more people come through?
I don't know. I guess my thought is similar, and I really kind of think that it may come down to like a mindset thing. Like, you know, this person has had their health issues get to a certain point, and then, like you say, now they're on medications. And I actually think that it becomes a scarier thing for the patient. Once they're on medications and they have a serious health condition, it's a little bit scarier to be like, oh, I'm gonna try something non-conventional. So I do think like, you know, what I mentioned before is like prevention is like the key really to keeping your cardiovascular system healthy. Cause I mean, there are certain things that we can do. Like, let's say you, are having clotting issues, like absolutely there are herbs that can help, but like David mentioned, like it becomes a little bit more difficult. And like, even as herbalists, we become a little bit, more tentative with what we suggest and that kind of stuff. So yeah, and I think that what I see a lot of is the early stages, and it's less so, like you mentioned, like it's less so that it's they're not coming in with early stages of atherosclerosis, but it's more so that they have something, and it tells me as a herbalist that their cardiovascular system isn't working optimally. So something I consider in a lot of cases is just the actual tissue perfusion. So in other words, the flow of blood in the tiny little capillary beds and the spaces around the cells in each tissue. So like when most people think about the cardiovascular system, they think of the heart and your arteries and veins, and we often actually don't even think about the largest part of our circulatory system, which is, and largest as in like percentage of the whole system, would be the microcirculation. So it's the tiniest parts, but it actually makes up the vast amount of the system. And this is the part that actually does the tissue nourishment, and it allows for the transfer of nutrients and oxygen to and from the tissues. So it's, yeah, not just delivering, but also taking waste and stuff away. So in the microcirculation, the vessels become so small that they're actually even more narrow than the width of one blood cell. So it's really important for these to be like flexible and to be able to do their function. And then the endothelial health, which is the lining of each blood cell, is also just as important. This is where we produce nitric oxide, which is allows us to expand and contract our vessels, which is like a really huge part of delivering blood to the tissues. It actually helps to regulate our blood flow besides the heart. So we have our heart as a quote unquote pump, but also the expansion and contraction of our small blood vessels also leads to movement of blood. And yeah, if you were to align the vascular endothelial cells in one person, they would actually go around the world 4 times. So this is obviously like hugely important, and therefore obviously makes a majority part of the cardiovascular system. And historically, it's been really, really hard to assess this because it's so tiny, and therefore it's been really neglected by modern science. And like still to this day, there's no specific treatments in our conventional Western medicine that have been developed for treating disorders at the microcirculatory level. Maybe there's 1 or 2, I think metformin will act in that way. But yeah, based on its vastness, like it's obviously something to consider, not just in circulatory related conditions or like the immediate things that you think of as being caused by a weak cardiovascular system, but also like a wide range of other diseases because of the nourishment really that blood brings. So yeah, what's your take on that? Do you consider cardiovascular system outside of the obvious? What are some conditions that come up for you when you think of supporting perfusion?
You know, most of what I could say specifically in the clinic, it's more emotional support when it comes to like, if we're making a daily tonic in the clinic, it's emotional support for the heart when somebody's like, I'm dealing with anxiety or I'm dealing with something specific that's really stressful. I think of the heart in that moment because, you know, as we'll see with like what causes these damages, chronic stress is a big component. So in a sense, I look at it more from a nervous system supporting the nerves, relaxing the person so that chronic stress goes down. And then sometimes when I see that affinity with the cardiovascular system, so somebody, again, has high stress or anxiety, I tend to bring the herbs into the heart section rather than the mind or the digestive tract, for example, like grounding herbs, I think, to center the person. And interesting enough, which one of the herbs we'll talk with later, go-to cola is an example of that, where somebody's dealing with anxiety and focus issues. We use that herb, but it increases microcirculation. So it is supporting, and it's a venous tonic. So it's doing all these things in a secondary action, which is the amazing part of herbs, that we might use it for this one thing, but it's doing all these other things along the way.
Mm-hmm. Definitely. And so, yeah, maybe some other things that we can think of when we think of cardiovascular system. I love that you brought the energetic component in, and thinking about like the heart energetically. But if you also have like something like a slow healing of literally any tissue. So if you find yourself that you heal slowly, that's probably a sign that your microvasculature needs some support. It could be, like athletic performance, anti-aging kind of stuff, but also hair loss. Like if you don't have good blood flow to the scalp, you may start losing hair. Diabetes, the microvasculature gets really affected. And even some like autoimmune diseases or like PCOS, where there's like a lot of stagnation. All these can point to needing better microcirculation. And I would actually argue that a lack of circulation is present in almost any sort of organ dysfunction, since all of our organs need to be properly perfused with blood in order to function properly. So every tissue is supplied by arterioles, capillaries, and venules. And some places, some organs require more blood flow than others. So that's like your retinas, your kidneys, your nerves, and your liver. Those are all particularly rich in microcirculation. And it's interesting that you brought up go-to cola, because one of the ways that I think that it works is like it is enhancing blood flow to all of these areas, and therefore like it makes you more calm because it helps perfusion to the nerves, or it allows you, like it increases circulation, and therefore organs can work better, and therefore you get that sense of like feeling more comfortable in your body. Because like the microcirculation really determines the blood and nutrient supply of all of our vital tissues. So without that, then everything starts to suffer. And then there's like especially vulnerable structures such as nerves that flow out of our spinal column into our limbs. That's like very much needing extra blood flow. So that's why like in conditions like diabetes, which damages the microcirculation, the organs that require a lot of blood actually get damaged first. So that's why you see issues with eyes and nerves and kidneys in conditions like that. And then, of course, another really, really important one is the liver. They found that there's major changes that occur in the microcirculation of the liver as we age, and that's really thought to be a major contributor to other age-related diseases. So it's been shown that a young, healthy liver has blood vessels that are actually totally unique to the liver, and they're really thin and full of holes, kind of like a mesh, and that's so that oxygen can pass freely from the blood to the liver and fuel all of its many metabolic processes. But with age, the vessels thicken and the holes kind of close off, so it loses its structure. And the theory goes that when this happens, the liver cells have less oxygen to do the metabolic processes, which of course includes transformation of toxins into less toxic forms. So when the liver is unable to do that, then those substances actually will get distributed to the rest of the body where they can settle or cause damage. Which is part of also what will contribute to some of the larger conditions like atherosclerosis and high cholesterol further down the line. So maybe let's talk about amazing. Yeah, it's super interesting, and this is actually, I think, a recently done study where they were able to observe this, and really, really interesting stuff. So let's maybe talk about the what actually will damage the cardiovascular system and microcirculation. What are your first things that come to mind for that?
Yeah, I mean, right as you were talking about that, like my brain started imagining the liver. Obviously, we know it's a filter; it's detoxifying the body. But I literally pictured it like a vacuum filter. If anybody's done a vacuum filter, so you like dump out the vacuum, you get all the stuff out of there, and then you take the filter out, and you can just like keep hitting the filter, and just stuff, no matter what, keeps coming out. And almost like you look at it and you're like, how is there still more things coming out of this filter? Like you feel like you've cleaned it all and it's still coming out. And so what you're talking about with this, with the liver and this circulation aspect, it's almost like that filter is so clogged that things just pass on through. It's no longer being filtered. And the first thing that came to my mind, which is common in our society, is alcohol, pollution, excess smoking. And all of these things are being detoxified by the liver. So, I mean, like right off the bat, and not to mention like constricting blood flow as well. So you're constricting the blood flow, then the liver has to pick up the demand of extra toxins. And so these secondary, like the liver damage is what's leading to all of these secondary cardiovascular issues that come off those things. So yeah, those three popped in my head right away as you were talking about that. And then we were talking about this earlier, stress is, I think, a big component.
Mm-hmm. Definitely. And I would add like poor glycemic control. So, lack of blood sugar stability. And so not necessarily like high blood sugar all the time. So you don't necessarily have to be diabetic or pre-diabetic even. But if you are constantly on the blood sugar roller coaster, so, we talked a little bit about that in an earlier episode, so I won't necessarily go into like what all that looks like, but the ups and downs of the blood sugar is definitely a major contributor, and even more so than some of the like more conventionally thought things that are conventionally thought to affect your cardiovascular system. So, for example, the dietary fats and cholesterol. So I think that is not necessarily even having an impact, and it's really more so about these other things like the chronic stress and the alcohol, the pollution, like, our general environment and our poor diets that tend to give us that roller coaster ride of blood sugar. Maybe let's go into like what the different conditions are, and like, so give people an explanation on like kind of an overview of what they are, and go into each of them a little bit. So maybe do you want to start by sharing, it's just an overview of like, what is high blood pressure and how does that relate to atherosclerosis and hyperlipidemia, which is high cholesterol?
Definitely. So, yeah, they're all kind of overlapping. One can be primary or secondary. So, like high blood pressure can lead to arteriosclerosis. So I was looking this up just to refresh my brain yesterday. You have arteriosclerosis and then you have atherosclerosis. Arteriosclerosis is just like the hardening or the lack of elasticity of the vascular. Arteriosclerosis is a very specific type of atherosclerosis. It's more like fat buildup on there, which is causing the hardening. But so you can have primary, secondary, like high blood pressure can lead to those conditions, or those conditions can lead to high blood pressure. It can go back and forth. And then with regards to fats, like I think this is part of the layman aspect of all this is we aren't taught so in depth in our normal education system about these things. We know a little bit more from our college, but all the different types of high or low, high fats, for example, like you have hyperlipidemia, you have high triglycerides, you have high cholesterol, and all these things are different versus like hyperlipidemia is fats in general, and then you have triglycerides or cholesterol. Ultimate, like high blood pressure, for example, can be caused by constriction of the blood vessels or hardening of the blood vessels, which causes the pressure of the heart to pretty much work harder to move it through the body. This isn't necessarily all a bad thing. You can actually, when you exercise or you have that quick adrenaline push, your blood vessels do constrict, and it's good for that quick burst, but then you want it to subside and you want the blood flow to open up again. But like high chronic stress states or excess pollution, all these things we were just talked about, having chronic constricted tissues, constricted blood vessels, lead to secondary actions. And on that note, if we're talking energetics, you can see how I use the term constricted. That would be a specific tissue state in the Western tradition. Constriction can often lead to heat, or it can lead to atrophy. So Kristin already touched on it earlier. If we have that constriction in the liver, for example, or in the microcirculation where things are not getting in or out, then you have atrophy, which leads to depletion of nutrients in the tissues and buildup of toxins in the tissues. So this is where you can kind of see how the energetics of how we would, I almost use the word diagnose. We don't diagnose, but how we clinically observe our clients through the Western energetics model to see where they're at, because they're going to be at different stages, whether it's constriction or heat or depletion, atrophy. But yeah, all of those three conditions that you brought up specifically, they can all lead to each other, or one can be the root cause.
What are your thoughts on salt for somebody with high blood pressure? Because that's something that, if someone gets diagnosed with high blood pressure, they're immediately told, a few things, right? They're immediately told eat less meat. They're immediately told eat less fat and eat less salt. So, pick your wherever you want to start with, but I'd like to get your thoughts on those.
I have two stories that I want to share, but I'm going to only pick one of them because I want you to talk about the opposite one. But I remember when I was in nutrition school, so I did nutrition school before I did herbal medicine school, and one of the texts was a functional medicine text. So it had nothing to do with herbs. It's all functional medicine. And I was completely unaware of what functional medicine was at the time. So I'm reading through the text. It goes through all the vitamins, all the fats, micronutrients, all that stuff, which just, I loved it. And then I got to starting to do these meal plans and diet analysis. So I'm starting to break down people's diets and show that. And I looked on this sheet, and I have all these pie graphs and bar graphs and all these things. And right at the bottom, there was a ratio, and it was sodium to potassium. And that interests me that you got all these documents, but then you have like sodium, potassium. There's other ratios that they use, but that one was a very specific one. So I looked it up. And really, the problem with salt, what I found in the functional text, was it's not that salt is bad. It's that our standard American diet, the SAD diet, tends to be way overloaded in salt and too low in potassium, which causes kidney issues, causes blood pressure issues. It's an imbalance of these electrolytes. And so really the solution is not to avoid salt. Well, it is kind of avoid salt, but really it's just to bring balance to potassium and sodium. And if somebody's eating a whole food diet, they're eating their fruits and vegetables, fruits and vegetables tend to be like super concentrated in potassium compared to sodium. So they're usually like 50-1 potassium to sodium, which means if you're eating a little bit more meat or if you're eating a little bit of chips, as long as you're still eating your fruits and vegetables, you're getting that potassium balance in there.
I totally agree. And I think that balance is a really important part, right? Because we focus on the sodium being a bad thing because it causes water retention. And while yes, that is true, like the in the greater context of things, it's really about the balance. And I would say like there's a big difference between table salt and sea salt, right? So table salt is really super refined, and it is literally just a sodium chloride molecule together. And whereas like sea salt or Himalayan pink salt, it's like they're full of all sorts of different minerals. They're a much more balanced way to get your salt in. So if you are still currently having like iodized table salt, get that out of there. and choose a more natural base salt from either the sea or like a Himalayan pink salt or something like that. I would say so for the cholesterol side of things, because I really want to touch on that. I know I said a little bit earlier, but Actually, sorry, I want to say one more thing about the salt thing, is that poor glycemic control can actually affect the way that we retain water and salt. So when they, tell you to get rid of the salt, it could actually be that you're having poor glycemic control. And it's found that up to 80% of people with high blood pressure also have some level of insulin resistance. So before you ditch your salt, check, get good quality salt, and then check your glycemic control, because that'll be a big piece in not only making sure that you don't get sick, but also in like in prevention, but also like if you're already in a space where you need to kind of do some damage control, that's going to be really essential. And then on the cholesterol side, I know that this is like it's crazy to me that this is still controversial, honestly. I think the conventional thinking was that like saturated fats, they do to your arteries what they would do if you poured it down a drain. And that's just like simply way too simple of thinking. Your cholesterol levels are not a result of, yes, they are affected by what you eat in your diet, but you produce like 80% of your own cholesterol or something like that. So why would your body produce it if it's not a useful thing for you? There's some role. And then it's really less about like what it is that you're eating and more about your ability to metabolize those fats. Your LDL and HDL, we like to categorize that into good and bad, and it's really, again, it's not that linear. They're different packages. So it's like the HDL is the package that takes your fat from your tissues and back to your liver. So it's kind of like the taxi driver that takes fats from your tissues out of storage so that you can use them for energy. That's why it's a positive thing. The LDL goes the other way. So it's the taxi cab that drives your fats into storage. So that's why they say, oh, not such a good thing. It's also been the one that's held responsible for fat accumulation in the arteries. But again, that is primarily caused by other things that are damaging your cardiovascular system, all your arteries. Essentially, what happens is something will create a small nick or like an initial kind of lesion in there. And if your body doesn't have the energy to repair and build that new tissue, it will do something else in order to kind of patch that up. And it uses those fats in order to do that. So one, again, is the glycemic control. Sugars in your blood are like sharp little glass shards, so they can cause a lot of damage. And then, of course, there's like the pollution and kind of all those other factors. So, again, the dietary cholesterol can actually be really supportive and really protective, because all of our cells they have a fat layer on the outside. And I don't know about you, but I would rather build my cells with strong saturated fats than really delicate plant fats that are more likely to go rancid. So I think we've gotten that one wrong. And the cholesterol thing, I just think it's really outdated. And the original studies have been that showed that cholesterol was bad have kind of been nullified in a way. Like they've kind of been shown to not really be accurate and true. So that's kind of the other thing. So if you're dealing with cardiovascular stuff, it's really hard to not follow the conventional the conventional instructions, but it's definitely worth doing a deeper look into these other things, because I think ultimately you'll get a lot more healing focusing on those versus cutting out salt and cholesterol.
Totally. And if you go down the rabbit hole with the health and this cholesterol, you'll come to these conclusions that Kristin's talking about, but recognize that it goes even, like, it'll kind of continue to spiral, right? Like there's, I don't want to say disinformation, maybe outdated information like Kristin's mentioning, but I even came across stuff in my text where saying VLDL was the real cholesterol molecule we need to be worried about. The very LDL, very low density lipoprotein. That was the one we need to really focus on, not the LDL. And so you can keep going and spiraling. Ultimately, I think, I mean, my text and what I think it is the sugar. It's a bigger component. The body spends a lot of energy to make sure sugar, glucose inside the blood it's like gasoline, right? Like it's combustible. It oxidizes really quickly. It's also very sharp, like Kristin said. So if it just bounces around. And, what they taught us in college is actually the way the blood flows. It doesn't really bump up against the structures of the arteries and veins. But once you start getting these sharp little pokey things, then they kind of like jab in. And once you start building up that cholesterol, then it compounds itself. But yeah, you brought it up with the sharpness, and it made me think of this acronym. I think they call it AGES, which I probably brought up in a previous podcast. Advanced glycosylated end product. And it's really just like these sugars it's almost like brown sugar where it's really sharp and really sweet, and it just goes through the body and just wreaks havoc.
Totally. Yeah, and that's I think where a lot of it begins for a lot of people. And of course that will affect it'll affect the large ones, but it'll affect the tiny ones almost even more, because it's all those molecules have to fit through those tiny little capillaries, and then those get quite damaged. And so the other thing that I want to talk about here with all of these main conditions is your nitric oxide production. So low nitric oxide can be a major reason why you start develop stiffening in your arteries. And again, this will start in the capillaries, and once you have atherosclerosis, you can assume that it's happened in the small ones, and now you're just seeing it in the large areas. But all structures in the cardiovascular system, I mentioned this earlier, but they all need to be able to dilate or contract, because this helps to maintain the blood flow. And there are a number of factors that will influence this, and that includes nerve supply and insulin and melatonin. But nitric oxide is really a key component of that, of the vasodilation, and that flexibility is a super, super big deal. And of course, I mean, blood viscosity and quality of red blood cells also matters, but each blood cell is actually wider. I said this earlier, that's actually wider in diameter than the internal diameter of the capillary. So so everything has to be able to expand, and your red blood cells also need to be flexible so that they can actually pass through those areas. So nitric oxide is a really, really important part of this function. And one of the best ways to improve this is actually through nasal breathing. So if you find yourself mouth breathing, either whether that is at night or during the day, definitely if you find yourself mouth breathing at night, it's worth to get checked out for sleep apnea or any kind of sleep disordered breathing, because that can really, really affect your daytime function. Yeah, I don't think I have anything else to say about that, but I just wanted to make sure that people know that nitric oxide is a really important part of this, and something as simple as nasal breathing can really enhance your nitric oxide production.
Yeah, I remember in college, one of our teachers, obviously we were in different classes, but maybe he shared this with you, but it's more on the metaphysical side that he brought up, the function of the heart and the red blood cell and the capillaries, that if you take the size of the heart, the strength that it has, obviously we know how strong the heart is as a muscle, but how strong it is to push these red blood cells through these capillaries in the body, the heart would have to be so much bigger to actually cause that to happen if it was just a pumping mechanism. If it was just a pump that forced these red blood cells in the capillaries, the heart wouldn't be the size, it'd be much bigger. So on the metaphysical side, you mentioned nitric oxide, which is it's dilating those vessels so that the red blood cells can get in there. But on the side of our source energy or our connection to where this energy comes from, that we're collecting energy from our environment that helps to propel these red blood cells deeper into our body, versus it just being solely the function of the heart. And, twice yesterday, since we're on the cardiovascular topic, heart math came up in conversations, in two separate conversations, and something to look into for people if they want to learn the importance and the little bit more scientific-based metaphysical aspect of the heart and its role in the body. And we're barely just touching the surface on what the heart's doing here.
Mm-hmm. Mm-hmm. The heart math stuff is super interesting. If you go down that rabbit hole, you'll learn about heart rate variability and how important that is for overall health, and definitely an interesting topic to dive deeper on. So I think the other side of these conditions is, so I think of like the atherosclerosis and the high cholesterol, like I think of those as being like primarily in arteries, and then and arteries are, if you aren't aware of this already, arteries are the part of your circulatory system that takes blood away from your heart. And the other flip side of that is venous insufficiency. So if the veins are not able to bring the blood back up to the heart, and it's interesting that you brought up the pump thing, because it's true. Like, your heart isn't necessarily strong enough to pump blood all the way down to your toes and then have that blood travel all the way up. So there are other mechanisms at play here. One of them particularly actually just being muscular. So your calf muscles have to move in order for your veins to be able to return that blood to your heart. But venous insufficiency is, I feel like it's a really, really common thing. And I think that it is, again, it's one of those like really early indicators that there's something greater going on. So like if you notice like little spider veins anywhere in your body, like that's where it starts. And that is the easiest place to heal them from, right? Once they become those really big, juicy varicose veins, then they're a little bit harder to get rid of. And like they can still be healed, but they need really like long-term persistent care. So yeah, if you start to see those signs that the venous function isn't working as well, then definitely do take it seriously, because it's a sign that your blood is not moving efficiently back up to your heart, and that puts a strain on the whole system. That can also be a sign of stagnant lymph flow. But it's definitely like, it's something that will contribute to like deep vein thrombosis and some of the larger conditions. A lot of people end up needing to get varicose veins removed when they become like totally dysfunctional. And while that, yes, that will take that one pathway out, it just means that you're taking that one main pathway out, and the rest of your structures are going to have to work extra hard to bring that blood back. So that's an important one to keep in mind. And like if you're a sufferer of hemorrhoids, that is varicose vein issue. So that's something where it's, again, worth it for you to check out cardiovascular system. And when we share some herbs later on, definitely worth looking into as well. And then I think maybe, David, you can expand on this a little bit. So like, what are some of the more major implications? We mentioned, 3 or 4 really major conditions. And then like, if you don't take care of it, then like, what does that all lead to for people?
Yeah, I mean, I would say is like the third phase, and it's probably, I would say just as common we see people in this third phase as we see people in the second phase. We get people with high blood pressure, sometimes dyslipidemia, blood fat issues, but then we also get people coming back in. They're like, I had a heart attack, I had a stroke, and so we see just as many people that have already gone to this third phase, and now are coming in and they want to do something more natural. Quite often it's because conventional medicine doesn't have much to offer them. They get thrown the medication, they're told to avoid salts and fats and then have a good one. But really, like, they're making that full circle back to like getting to the root cause and getting to what we'll talk about here in a minute, but like the preventative stuff. I would say the drawback once it reaches these 3 things, so heart attack, myocardial infarction, stroke, or TIA, which is like a mini stroke as they call it, These are the end results of long-term high blood pressure, atherosclerosis, these types of things. And yeah, the hard part with this is if somebody really wants to go herbally hard with some of these like antiplatelet herbs, anticoagulant herbs, quite often there's a contraindication with pharmaceuticals at that point. So if they're on these stronger medications, we get more limited what we can do with the stronger herbs, and we have to really focus on the diet and lifestyle type stuff to really support them. However, talk to your healthcare practitioner on the best approach for you on how you want to go about this. We've had multiple people come through that want to come off their pharmaceuticals, and we will fully work with them side by side. But I always tell them to go talk to their doctor and let their doctor know that they're doing this, because most of those hardcore medications that you start, you can't just stop abruptly. You can't just start a high blood pressure medication and then come off, or an anticoagulant medication and come off, because you'll have this reverse action of it. And just a quick story, a client of mine, younger guy, came in, in his 20s. This was a few years ago, but in his 20s, had total party lifestyle, drinking, smoking, drugs, all that stuff. And he said he went to his doctor, and his doctor said, yeah, your blood pressure is slightly elevated. Here you go. Here's a blood pressure medication. And the guy went home, did his research, read the medication. He saw hey, if I start this, I can't stop this. And so he was like, what else can I do? The doctor didn't say stop drinking, stop smoking, stop doing drugs. He's just like, here's a high blood pressure medication. And this person went the other route. He went the holistic route versus starting a blood pressure medication. But think about starting a medication for high blood pressure in your 20s, just because of more of a diet lifestyle change that really needs to be changed. But ultimately, high blood pressure from 20s into your 60s can lead to these three major conditions.
Mm-hmm. Definitely. And I want to get your thoughts too on long-term care with herbs. So I think in a lot of ideal situations, we use herbs as a tonic, which can mean you use it for a period of time, and it actually does heal and repair and restore tissue function. And therefore, the hope is, in an ideal situation, you would be able to heal that system and then actually not need a reliance on those herbs anymore. So in terms of the cardiovascular system, do you have any thoughts on that? And in terms of that spectrum, so where are they starting from, and how serious is that condition, and how helpful are herbs as a result?
Yeah, it's kind of like a lot of the conditions we see. It depends on how long it's been happening to how far you can revert it. They say, when we do our energetics with it, that if a condition becomes cold, that's a bad sign. So if I use arthritis as an example, if somebody has arthritis in a joint and it's still hot and there's heat, there's pain, maybe sharp, stabby pain, that's usually actually a good sign, because that means there's still vital force or vital energy in there, and you can kind of reverse it. But once it gets cold and stuck and dull, achy pain and lack of movement, you're getting into the stages of osteoarthritis where it's you're not going to be able to reverse it. And I would say it's the same with the cardiovascular system. Unfortunately, it's not so easy to see or diagnose these things. So when somebody's in the hot condition of high blood pressure, unless they're getting their blood pressure checked, they're not going to necessarily notice that they're slightly elevated. It's usually in the later stages where high blood pressure is so high that it's causing in a sense tissue death, because it's getting starved of nutrition. So it depends on the stages, but ultimately I think the long-term approach, because herbs, these stronger herbs, you can totally do it regularly, but the long-term approach can be literally food, and then it can be growing your own medicine, especially if this is a really chronic issue. The guy that came in yesterday, he's asking my thoughts, whatever. And I shared a couple herbs, and like another one that came to mind is, getting some hawthorn berry for your blood pressure. And he's like, oh, yep, I already got that. I harvested a whole bunch this last year, and so I'm still working my way through it. And I mean, that is the herbal medicine path, like people taking and going and getting their own medicine. So does that answer your question, kind of like what you're saying, like long-term approaches with herbs, or just like the success we see with it?
Yeah, I guess I'm thinking like I'm thinking like if we had a mild condition come in, so like maybe something that in that list that we mentioned earlier that is related to a microcirculatory issue. So for example, like hair loss, or something that's a little bit less serious. I feel like when we can use tonics. We can use things like Go-To Cola that support the structure of the microvasculature, and I feel like, in a sense, that can be healing, and you can have a stage where you take the herb and then you can actually come off the herb, and like we've actually done the healing. Whereas I'm thinking like in the more serious things, like after you've already developed atherosclerosis, like you might need herbs to support forever. That's sort of like, is that also like, do you find that in your practice?
Totally. Yeah, I agree. The later you go, the more you're going to need it, kind of thing. It's kind of an inverted approach in the holistic medicine. Inverted in probably the sense it's more upright and proper, but in conventional medicine, they tend to give you like pharmaceuticals up until like late stage end of life, and then the next thing they're giving you is like electrolytes. They're giving you magnesium, potassium, all these things that actually should have been given to you originally. And with these earlier conditions, diet, lifestyle, and herbs can kind of put you in a good place, and then you have to maintain it, obviously. If you do these tonics for microcirculation, you then can't just go out and just keep eating ice cream every single night, because it's just gonna speed up the process. There's lifestyle changes that come along with supporting earlier conditions with herbs, and then the later conditions, like it's almost like guaranteed, like switch your diet completely, and you're gonna need the herbs as well.
Mm-hmm. So on that note, before we actually get into what herbs we commonly use, do you have any thoughts of based on your client yesterday saying that they harvested their hawthorn and they take it themselves, like what are your thoughts on people self-treating cardiovascular conditions?
Depends on the herb for sure. Dan Shen is one of our stronger ones. I guess it's safer. I guess it's safe, but in the sense like giving yourself that herb too much in the wrong place with a medication can lead to bad issues. I think, there's a role for a herbalist or like somebody that has the training. Like, I think people can go get their own medicine, hawthorn berry, yarrow for blood pressure, for example. Like, they can get these things, but they're going to need to ask somebody. I think they should ask a herbalist, somebody that's trained in it, like proper dosage and what to do with it, versus Google. I think Google can lead people astray. Specifically with this guy yesterday, I brought up Go-To Cola. I brought up Go-To Cola with a previous client, and he overheard the conversation, and then he was curious about it as what it was used for. And he's like, but I've read some stuff on the internet about Go-To Cola, having these negative effects. He didn't really specify, but I've read it. And if you read too much of the internet, it tells you like Go-To Cola has been shown to cause liver damage, and that's why you don't give it to children. And so that's where I would say self-treating, self-doing herbs can kind of, like, you can get bad information from the wrong place or not know what you're doing. So check with a herbalist. Obviously, we have like, in your practice and my practice, we have like therapeutic grade tincture extracts. So we're working with a lot stronger herbs, and quite often what I see is people actually aren't doing enough of the herbs to really see the benefits that they need. So talk with herbalists. That's where I would say, like, totally people take their power back, you grow your own medicine, do your thing, but talk with somebody that knows the folk remedies, the medicines, and better than the Google, in my opinion, or AI. That's the big topic these days.
Yeah, totally. Yeah, I second that big time. I think people can get lost on Google, and I mean, I am all for people knowing and understanding herbal medicine, because I truly do believe this is the people's medicine, and like, you should be able to grow medicine in your backyard and know exactly how to use it. But when we were talking about more serious conditions, it's when we're trying to reverse a serious condition, if that's even possible for you, I think it requires a little bit more nuance. And like you say, like there's stuff on Google that is just not necessarily always true. I saw a pharmacist post something the other day. So this is unrelated to cardiovascular system, but just on the note of self-treating, is she was talking about supplements for anxiety, for anxiety and depression, so mood disorders. And she was basically saying that she likes all of the supplements that are like magnesium and zinc and vitamin C, but she really doesn't like when people go and use ashwagandha and St. John's wort. And her reasoning was because it, like, the benefits or the risks outweigh the benefits. And I was like, I watched this and I was like, it made me really mad. I was like, oh my God, you're taking away people's tools that are actually really, really helpful to some people, because you don't understand the tool. And this is a really well-educated pharmacist person, like, it's not somebody who's just recommending random stuff. Like, this is an intelligent person who's well-educated, and who still has bad information on herbs, because this is not their area of expertise. And what they see is, they see pharmaceuticals, and they see supplements, and they prescribe supplements as they would pharmaceuticals, and you cannot prescribe herbs as you would a pharmaceutical. They are simply not the same thing. You cannot treat each person exactly the same way. There are no, blanket recommendations when it comes to herbs. So I guess all that to say is, like, even if it's like a source that you trust, like, get a really good source for herbal information. And I hope that we're offering you that here, because I really think that it is not that easy to access really good information on herbal medicines. And just because it comes from, like, what you consider a good source doesn't necessarily mean it's all true. Like, she was saying that ashwagandha is, like, potentially dangerous, and it's like, in comparison, like, she was saying an SSRI is less dangerous than ashwagandha, and I just simply think that is not true, and I think we just cannot use them in the same way. So all that's to say, get good herbal information, and self-treating is totally okay in certain situations, and if you understand the herbs, and if you understand your body, So that being said, let's talk about some herbs that we use in terms of supporting the cardiovascular system. What are your go-tos?
Yeah, I'm looking at the list we've kind of put together, and I didn't put it in any specific order. I would say my go-tos for microcirculation is go-to cola. Ginkgo it helps with microcirculation. However, I find that one a little bit more pointed. I mean, it might be my own response to it, but I don't tend to give Ginkgo as much as I give go-to cola. Mm-hmm. So those would be the two microcirculations that I really focus on. I mean, we have other herbs like prickly ash, cayenne. We don't use cayenne. It's in our cabinet. We have it there for pain relief specifically. But you could put it in a formula, and it's cardiovascular protective, microcirculation. So microcirculation, that's what I would focus on. And then this came up in conversation with the guy yesterday, and I'll highlight it because I want to hear your perspective on some of these too, because you've taught me a lot about a couple of them that I don't use very often. But globe artichoke came up in the conversation yesterday, because he's like, I'm like, have you heard of globe artichoke? He's like, I was going to grow that this last year in my garden, like totally grow it. Like, it's great for high cholesterol. It helps with liver support. And, it's that alternative for a statin. Now, with the caveat here, and to tie in with what Kristin was saying, working with a herbalist or somebody that knows herbal medicine in a more in-depth setting especially if you have these chronic issues, is you're going to get way more results versus than like just self-treating and like taking stabs at things. And you know, certain high blood pressure, so if you have really high blood pressure, or you know, you have really high cholesterol, you can't expect these herbs to just pull off absolute miracles. They do work. They work more effectively getting it early rather than later. You know, we had a client in clinic that had blood pressure. It was like 190 over 110. It was something crazy. And this was when I was in college. And she's like, I'm not taking any pharmaceuticals. I refuse to do it. I want herbs only. And the practitioner working with her was like, okay, we'll give you what we have. And then we chatted as students and practitioners. He's like, I will be telling this client she needs to be on pharmaceuticals. Her blood pressure is way too high. The herbs are going to help, but they're not going to take it down from this level to being a healthy level. Like there's something else going on. It needs a way deeper look. So yes, just to end all that and to talk about those microcirculation herbs, I would say if this is a complex issue, you'll get so much more out of talking with a herbalist and doing that in-depth consultation where you change diet, lifestyle, than just grabbing some hawthorn berry off a tree and trying that way kind of thing. So
definitely. And like, yeah, like you say, like they've been shown to work, but individual cases need to be considered. And I would say, interestingly, some of our heart-based remedies, like from the traditional literature, they looked at the heart and blood a little bit differently than what we look at today, because our Western point of view really looks at the physical structures. Like, you know, we've kind of dissected the human body at this point, and we know what all the structures look like, and we can make... I'm not going to say we know exactly what everything does, because the body is kind of a mysterious miracle, and we truly can't know everything about it. The same way we can't know everything about how the world works, you know, like how our universe works. Like it's sort of just a miracle that we have to accept there's magic in there. But they viewed heart and blood a little bit differently back in the day, because they didn't have, you know, the actual visual representation. Like they knew that people had a heartbeat. They knew that that things were they knew that we bled when we were cut, and that played some vital role in our ability to continue to live. They could see heat, they could see redness, you know, so like they could see that in a sick person, there was less heat in the body, and that there was, you know, like there was a less of a pulse, you know, a less strong pulse. So those were really like what they were going off of when they were assessing if something works on the cardiovascular system or not. And so a lot of it, what the herbs do is as like a peripheral vasodilator. So like you'll see this perfusion of blood in the system, and that's what you'll see with like prickly ash and ginger and cayenne. Like you'll see that immediate blood perfusion. You'll see the redness and you'll feel the heat. And then like some of the other ones that we can use, like we can use what was I gonna say? We can use dandelion leaf in a similar way as a diuretic, right? Like this wouldn't necessarily be the traditional way of moving blood, but you know, as a more modern perspective, like we would use dandelion leaf. It's a potassium sparing diuretic, so it helps to balance out that potassium sodium balance that we need. We also can use horsetail in a similar way. And then like you mentioned like way earlier, is that there is actually like a stress-based, heart-based component of cardiovascular disease. So even using things that calm and relax the body, so valerian, cramp bark, skullcap, these can all be really helpful in managing expressions of whether that's blood stagnation or this kind of like blood excess of hypertension. And then do you have anything else to add for those? I want to say one thing about, like before we wrap up, I do want to say one thing about the venous insufficiency, because we use different types of herbs for that. But in terms of our like high blood pressure, cardio tonic type herbs, do you have any other thoughts there?
Totally. Yeah, I mean, these other ones, and again, this is kind of like talk with herbalists, but garlic, for example, garlic cooking with, great. Like that's the long-term supports with garlic to really protect the cardiovascular. It does so many things, but protect the cardiovascular system, anticoagulant, all these things. But when you're using a therapeutic dose, when you're using like a tincture extract of garlic, then you're getting into like not murky or scary, like, but if you're taking a medication and then you're taking a concentrated garlic extract on top of it, you can put yourself in a position where like you're having issues. But garlic is an amazing plant for the heart, and specifically, and one I don't use really often is yarrow. I've heard so many herbalists love yarrow. They use it for so many different things, energetically, therapeutically, but it's a vasodilator, plus it's a diuretic. So that's another amazing herb that I don't use often enough. And on the list, those are the ones that I kind of wanted to highlight for sure. I mean, before you go into venous insufficiency, I think if you could share a little bit about like Jemima and Chinese skullcap, because I use those, but not like you use them, and I think people would benefit from your use in those in these situations.
For sure. So Chinese skullcap is one of my favorite herbs. It's such a cool one because it's like how do you do all that things? Like it has so many amazing actions. It surprises me all the time. So in terms of high blood pressure, so you'll have heard us, if you listen to the podcast, if you've listened to other episodes, you'll have heard us talk about histamine intolerance possibly, or mast cell activation. Both of these can contribute to high blood pressure expressions. And Chinese skullcap can help in that way. In terms of reducing your histamine load, and that itself, histamine is a vasodilator, and it's also it's a stimulant, and it can make your blood pressure increase. So you can use Chinese skullcap in that way, but it also it is a liver protector, so will support the microvasculature inside the liver. So kind of cutting off that inflammatory cascade that happens when the liver starts to shut down. And trying to think if there's anything else to add about Chinese skullcap. It's actually a pretty amazing cooling remedy. So that is in opposition to, let's say, something like ginger and prickly ash and what was the other one? Cayenne. That you mentioned. Yeah. So all of those are they're great. They do move the blood, but they're all heating remedies. They're all hot by nature. So if you are a hot person with high blood pressure, you can still use the hot herbs, but you need to balance them out for sure. And Chinese skullcap, also, actually, both skullcaps are wonderfully cooling remedies. In fact, Chinese skullcap in particular is contraindicated in what we'd call cold conditions. That's specifically from the Chinese medicine perspective. But if you can, one, we have an energetics podcast, so if the quote-unquote cold thing doesn't mean anything to you, then go watch that episode, because it gives you an idea of what we're talking about here. But yeah, so the cold from a Chinese medicine perspective can really look like a lack of blood and not moving blood. And so it can help in that sense. Jemima is an excellent cholesterol reducer. So I find that it's particularly helpful by not allowing absorption of cholesterol in the gut. So it's not a binder
necessarily, but it kind of acts in that way almost, where it reduces the absorption of stuff from your gut back into the body, and that looks like cholesterol and blood sugar, sugar really. It stops the absorption from your small intestine of sugar into the body. So Gymnema is one of those ones that we use in poor glycemic control. So that can look like PCOS, it can look like diabetes. And so it can be a big part of, yes, healing those things, but also, like, if you're not in those places yet, preventing, damage due to poor glycemic control down the line. And yeah, Gymnema is one of those ones that I think that's worth it to work with a practitioner if you're interested in using a herb like that. Gymnema is a really cool one. If you take it orally with a tincture, it'll actually block your sugar taste receptors. So for a little bit, you can't taste sugar, and it is the weirdest sensation ever. You're like, you take this, and then if you literally take a spoonful of sugar, it's like eating sand. Like, you'll taste the texture, and that's it. It is super weird. So you can kind of do aversion therapy with sugar. So if you're like a major sugar addict, you can use Gymnema in that way to manage your sugar cravings, because all of a sudden, like, you have sugar and you're like, oh, that's not satisfying at all, right? You don't get the dopamine hit from your sugar taste receptors. So that can be helpful in glycemic control, but it is also, like, really, really helpful in the gut. It improves insulin sensitivity overall, but then also reduces or blunts the blood sugar spike because of that absorption thing. So those are two really, really interesting and beneficial ones. The catch with Gymnema is that it is a high saponin herb. So saponins can be really irritating to the gut lining. You can think of saponin like a soap, really. If you had a tea that's high in saponins and you shake it, you'll see a bunch of bubbles. So it's it creates like a mini lather inside. And that can be, like, it can really break down mucus, mucus layers in the gut, and then that makes you, it kind of dries you out. It makes you more susceptible to leaky gut and different abrasions and even potential infections in the gut. So you definitely want to make sure that you're working with a practitioner with a herb like that, so that you can be monitored, know when it's time to come off of it, if there is the time, getting the right strength of herb, because Gymnema, you actually do need quite a lot of it. So we often use standardized extracts. And yeah, just kind of making sure that it is giving you benefits and not doing harm, because like we were saying earlier, my anecdote about the pharmacist is, like, she's not wrong when she says caution with those things. She's wrong when she says don't use them. But she's not wrong when she says caution, because, like, they are powerful medicines, right? I feel like there's two camps in society. Like, there's the people who don't believe that herbal medicines work at all, right? It's like, oh, they're harmless, and or they don't even work. It's like, whatever, don't even bother with them. But then there's the other camp that's like, oh, be careful, they're really powerful, and you can really ruin your health with them. And it's like, I think the reality is somewhere in the middle. I think that the reality is, yes, some of them are really, really gentle, and some of them are not so gentle, and that's where people like David and I come in. That's where we're a really big help, because we kind of understand the plants a little bit more, and we can understand the nuance of, like, when is the right time to use them and when is not the right time to use them. So don't be afraid of herbs like Gymnema, because they can affect your gut health in a negative way if you don't use it properly, or if you use it not in the right person. So, but don't be afraid of it, because just know that there are nuances, and that there are people that can help guide you through the process, because they are powerful and really beneficial medicines when used correctly. So, yeah. Anything else that you wanted to add there?
No, perfect. I'm pretty new to using Chinese skullcap, so I use it for very specific things, blood pressure being one of them. But Yeah, you've taken a whole nother spin on it and applied it in so many different ways that I like. I like getting refreshers on how it's used, because it is one of those herbs where you kind of look at the list and you're like, whoa, it's doing all of these different actions. It's quite amazing. Rosemary is one of those herbs, but I don't use rosemary very often. Where you like, it's 2 pages of actions. So, but yeah, cool.
Totally. Yeah. So the last thing is that. Okay, I'll say caution about some of those first. Well, like I mentioned, like the high saponin herbs, like Gymnema, definitely use with caution. Caution if you are on medications. Don't just try some powerful blood pressure altering herbs, because one, it can either enhance the effect of your medications, you can drop your blood pressure way too low. And so something like actually coleus, one that we haven't mentioned, is one of the stronger ones. And again, I would say this is kind of like a with practitioner use, because a lot of the herbs that we have, they are useful. Yes, they do work. Yes, but they generally work slower. And that is a safe thing for people to explore with on their own in that sense. So like we would never tell you, oh no, don't use ginger. Oh, don't eat garlic because it can affect your blood pressure. Like, that's fine, use those. But if you need something that is going to have a stronger action, something like coleus will have that fast action. And it will have, a strong lowering effect on your blood pressure. But then that is like a use with caution, use with a practitioner kind of thing. And then lastly, we have our vascular tonics. So if you are a hemorrhoid sufferer, if you have low blood pressure, if you get dizzy upon standing, if you have varicose veins or spider veins, then vascular tonics will be helpful for you. You can use, so for spider veins and varicose veins, you can use witch hazel topically, you can use horse chestnut topically. Both of these are like tannin-rich herbs, which means they will tonify and like bring tissue back together. If you ever had a tannin-rich red wine, a glass of red wine, and you get that kind of like dry feeling on your tongue, that's tannins. It's like they will dry out tissue. We call it astringent, and then it'll actually knit tissue back together. So it will improve tissue integrity. So both horse chestnut and witch hazel work like that. We would use blueberry as well. So like blueberry is a food that you can eat tons and tons of. We do have a blueberry, or we call it bilberry, in a tincture form, but you need so much of it that like you're better off just eating blueberries. But that can really help with the tone, but also vascular integrity. And that's the same goes for gotu kola, like we've mentioned before, and then also linden. Linden is one of those awesome gentle herbs that supports capillary fragility. So if you're somebody who gets a lot of bruises, like if you bruise super, super easy, or you like bruise or bleed easily, that's a sign that you have capillary fragility, and something like tilia or gotu kola will be a super helper for you. I think that's all I've got for herbs. Anything to add there?
Lemon peel, but that's it's a stretch for some people. You can squeeze your lemons in your water, but then grate the lemon peel. It's got flavonoids in it, similar to like blueberries that do the same thing. But every time I make that suggestion to people, it's usually a pretty big stretch. I mean, it's a little bit more work. It's like eating pulp. A lot of people don't like it, but if somebody's really serious, lemon peel is a good way to go too.
Mm-hmm. I think we have capsules at the shop now with lemon peel, right? Lemon peel and what's the is it maki berry? Oh, I can't remember.
Yeah, I don't know how to pronounce it. I think it's makwai berry. I don't know. I'm putting my little French twist on it, but makwai. It's a deep purple berry, just like blueberries. So usually, it's a good alternative for like a natural vitamin C supplement, but also it's super rich in those antioxidants. So I haven't used them so much clinically that I've seen like these results from people, but I look forward to. I've taken them a few times myself.
But a good way to get your orange or your lemon peel in if you are not
Like if you're not into eating lemon peel.
Yeah, totally.
Cool. Well, I think that's all we've got for you today. I hope you all enjoyed learning a little bit more about your cardiovascular system. And let us know if you enjoyed this podcast. Give us a subscribe or a like or however these platforms work. Yeah, if you want to get a hold of us and learn more about herbal medicines, then we are both on Instagram. You can find all of our information linked below the description below the video in the description. And we both work one-on-one with clients. So if you are looking for a little bit deeper support and you want some herbal expert knowledge right on your individual case, then please do reach out to us. You can find our websites, our Instagrams, and any other way to reach us linked below this video. So again, I hope you enjoyed this podcast, and we will see you next time.